I'm Alexis Mooring, and I'm a licensed marriage and family therapist candidate. I'm passionate about working with first responders. My brother and my husband are both first responders, and so I understand some of the things that, the unique challenges that they're presented with in their jobs. I understand some of the stressors that the families endure in a first responder relationship, and so I think working with that couple system, that family system, even the individual and some of their trauma that they've gone through is something that's very near and dear to my heart. I think it is a challenge to get first responders to ask for help sometimes when they need it. I think they're expected to uphold so much and really be seen as, with a certain perspective with the community. I think coming into therapy shows some of the most strength because it's hard to ask for help or to come and get help or, go through something vulnerable with somebody else. I'm not gonna just give up or just be like, okay, well, maybe next time things will be different. Like, I'm gonna work on breaking down that wall. So whatever that looks like, whether it's they just need some more sessions to get comfortable speaking with me, or maybe they need me to switch my techniques up. Whenever I am speaking with a first responder, I don't want to just leave them open, to leave my room and have all this trauma and all these things undealt with and left out for their day tomorrow. Then I'll guide them through how to process that with me, but then put it in their container where it's safe and secure until the next time they come in and are ready to again work on pulling that trauma back out and working through it. Letting them know that it's safe to talk and that what we do in therapy stays here. It's confidential, so nothing that they share, unless they're harm to themselves or others, obviously is going to be shared. And so I think that's nice too, because I think right now, just in the world, it's hard. Everything is kind of hard. I mean, there's a lot going on, and so I know that first responders are sometimes seeing the darkest and scariest parts of our world, and so they need someone to talk to. They need someone to bounce that off of. And one of the biggest things that I like to do for my first responders, and one of the things I think is most important, is not just therapy with them, because while I think that's very important, but I really want to engage their families. They need support outside of me. They need their wife or their husband. They need their kids. They need their moms, dads, family members. And so whatever that looks like for that first responder, that's what I want to cultivate in therapy, and that's what I want to help them to engage more in their support system. I would love to work with people with a cancer diagnosis and their families, and I'm definitely passionate about that, and I have a lot of experience doing it. I don't think people realize how much a family and the relationships that a person with a cancer diagnosis has, like how much impact they have on that person's actual healing. When I was working at the Cancer Treatment Center, they taught us that hope is one of the biggest indicators of how long someone would live. One of my main goals as a therapist, whenever I'm working with cancer patients, is to instill hope, not just in them, but in their family. And so the families have a lot of impact when it comes to like their grief and how they're dealing with the diagnosis at that point, because if they don't have a lot of hope, then it really impacts the healing and the well-being of the patient. It's something that I enjoy working with, and it's a privilege, honestly, to work with people in those really vulnerable and difficult stages of life. If you felt like you could relate to any of the things that I talked about, and you want to see if we might be a good fit, you can give us a call and schedule a free 30-minute consultation, and we'll just have a conversation and see if we would be a good match. And if you know that you're ready to dig in and you know that you want me to be your therapist, give us a call too, and we can start right away.